right, knee evaluation, start with the past and present history, move on to inspection, look for any swelling, discoloration, deformities, or gait. Bony palpations, tibia, start with the plateau, and the tuberosity, shaft, femur, shaft, and the condyles, fibula, the head, and the shaft, patella, the borders, and the body, looking for fractures. On to soft tissue, medial collateral ligament, looking for a sprain, lateral collateral ligament, menisci at the joint line, patellar tendon, looking for a rupture or tendinitis, popliteal fossa for any cysts or tendinitis, quadriceps, rectus femoris, vastus medialis, and vastus lateralis for strains, pes anzeri group, sartorius, gracialis, and semitendinitis, looking for tendinitis. Hamstrings, can you flip over on your stomach? Hamstrings, biceps femoris, semimembranosus, and semitendinitis. All right, you can flip back over. All right, IT band, right along the side. Okay, stress test, valgus stress, 0 degrees. Going this way, ACL and MCL, then at 30 degrees, just for the MCL. Right, varus stress test, 0 degrees for the ACL and the LCL, 30 degrees just for the LCL. All right, Lockman's test, testing the ACL, have my hands on the joint, and I go upward. Okay, anterior drawer test, this way for the ACL and the anteromedial and lateral stability. Upward. Posterior drawer test for the PCL and posterior instability. Okay, and Goffrey's 90-degree test. Both knees, get on your back a little bit. Lay on your back. Both knees at 90. Get on the side. Okay, that's good. All right, you can come up. All right, special tests. Sweep test, going above the patella, looking for joint effusion. Patellar allotment test, also joint effusion. If there's any swelling, I'd be pushing straight downward on that. Sulcum drawer test, anteromedial and lateral instability, just an anterior drawer test with inversion. Right, and then eversion. Okay. Quadriceps active test for the PCL. Just go ahead and try to kick. Okay. Awesome. Bounce home test. Just hold right here and drop. And that's for the menisci. McMurray's test would be, I'd go right up over here, feel, go outward, extension and flexion with inversion and eversion. Apley's compression test, will you get on your stomach, please? Okay, so we're pushing downward or upward for the distraction test. Okay, you can get back on your stomach or on your back. Apprehension test, patellar subluxation and dislocation. I'd be pushing the patella this way, looking for any slip or fear of dislocation. Let's see. Clark sign, patellar downward on the patella. Okay, Noble test. That would be the IT band. Lay on your back a little bit. Get up. See if I'd have my thumb right on the IT band. Extension and flexion. See if there's any discomfort. Inversion, eversion. Okay, you can sit up. And the O'Bears test. Can you get on your side that way? Lay on your right. Yeah. So I put the ankle in my armpit, my hand under the knee, upward, backward, and drop. Okay, that's good. Let's test in the menisci, or IT band inflammation, I should say. Okay, range of motion, flexion to 135, extension to 0, internal rotation 10 degrees, external rotation 10 degrees. Right, can you scoot to the edge of the table? Extension, quadriceps and femoral nerve, kick. Okay, one more time, kick. All right, will you lay on your stomach, please? Flexion in the hamstrings, kick upward. Sciatic nerve, one more time. Okay, cool, you can stand up. Okay, knee extension and hip abduction, or adduction, inward, thank you. Dorsiflexion and inversion of the ankle. Yeah, that's L4. L5, toe extension, extend your toes. L5 through S1, knee flexion, so like that. Okay, S1, ankle eversion, go outward. Okay, and S1 and S2, ankle plantar flexion. Okay. L3, medial knee. L4, medial surface of the foot. L5, dorsum of the foot. S1, lateral surface of the foot. S2, medial gastrocnemius. L4 is the patellar tendon. Would you sit up here, please? Patellar tendon reflex test. Relax your knee. Get there, watch for the reflex. And then the Achilles tendon. Relax your foot. Okay. And then blood flow, papillary artery. Right here. Dorsal pedal artery on the foot. Recapillarization test. I would check to make sure the blood returned to the toes. And I would compare bilaterally.